Hello, my friend. I'm Dr. Mary Parker, a wellness educator focused on men's health, vitality, and longevity after 50. Today, I want to talk to you about something almost no one connects with erectile difficulties. Yet you probably do it several times a day in the most private room of your home, the bathroom. It's not a pill, not a special exercise, not a complicated technique. It's a very common habit that seems harmless. But when you repeat it for years, it can quietly weaken your circulation, your pelvic muscles, and your confidence in intimacy much more than you realize. For decades, men have been told a very simple story. As you get older, your energy fades, your erections get weaker, and that's just how it is. If things don't work as well in the bedroom, many people blame age, low testosterone, or bad luck. But the more we study male health in the second half of life, the more we see a different picture. The body keeps an incredible potential for intimate vitality even in your 60s, 70s, and beyond. What changes is that your system becomes less forgiving of daily habits that block circulation, irritate nerves, or overload the pelvic floor. And one of those habits sits right under you every day, the way you use the toilet. I want you to imagine a perfectly normal morning. The alarm rings, you slowly wake up, and your bladder is full. You go to the bathroom, sit down on the toilet, and almost automatically your hand reaches for your phone. Just a minute while I finish, you tell yourself. You check the news, skim a few messages, open one or two videos. Minutes go by. Maybe you already finished a bowel movement in the first few minutes, but you stay seated because this feels like your quiet moment of the day. By the time you stand up, your legs are a bit numb, you feel a slight pressure in the rectal area, and there may be some heaviness in the lower pelvis. You wash your hands and move on. It feels harmless. You have done it like this for years. Now I want you to see that same scene from inside the body. When you sit on a toilet seat, especially a hard, narrow one, a very delicate region ends up carrying most of your weight. The perineum, the area between the anus and the genitals. Through that small zone run important blood vessels and nerves. It is also where key muscles of the pelvic floor attach. You can think of the perineum as a crossroads for your intimate circulation, your sensitivity, and your continence. If that area is under pressure for a short time, the body tolerates it. But if you press down on it with most of your weight for 15 or 20 minutes, several times a day, year after year, the story changes. To understand why this matters for erectile function, let's briefly review what has to happen in your body for a firm erection to appear and stay. It is not just hormones or desire. It is a coordinated dance between the brain, the nervous system, the arteries, the veins, and the pelvic floor. Your brain has to feel safe, relaxed, and receptive. The arteries leading to the penis have to open so that blood can rush in. At the same time, small veins that normally drain that blood have to tighten a little to trap it inside. Finally, the pelvic floor muscles help support pressure in the area so the blood stays where it needs to be. If any one of those steps is weak, the whole system struggles. After 60, it is common to have stiffer arteries, more sensitive nerves, maybe a history of high blood pressure, diabetes, surgery, or medication use. That means your system is already working harder to produce the same result. In that situation, anything that interferes with blood flow or nerve health in the pelvic region can push things in the wrong direction. That is why the simple bathroom habit we're talking about today is not just a detail. It directly interacts with the same tissues you need for intimate vitality. So what is the habit? It is the combination of three things: spending too long sitting on the toilet, using the phone, or reading in a way that makes you stay there far past the time your body needs, and pushing or straining harder than necessary to evacuate. The toilet becomes a compression chair for the perineum. The phone becomes the excuse that keeps you there, and the straining turns every bathroom trip into a little training session in tension for your pelvic floor. All of that happens exactly in the zone you depend on for good erections. Let's talk about the first element: time. A healthy bowel movement usually does not require 15 or 20 minutes of sitting. For most people, if things are working well, the urge appears, you sit down, the body does its job in a few minutes, and then the signal fades. When you stay much longer than that, most of that extra time is not truly productive for your intestines. It's simply extra pressure on the tissues under you. The hard rim of the toilet seat presses into the perineum and the backs of the thighs. This mechanical pressure can slow down blood flow in small vessels, a bit like stepping on a garden hose. The water still moves, but with less strength. If you do that briefly, it's not a big issue. If you do it for 20 minutes, 2 or 3 times a day, for years, you are constantly asking your intimate circulation to work through unnecessary obstacles. The second element is what happens to your nerves. Nerves are like electrical cables wrapped in a delicate insulating material. They do not enjoy being squeezed, stretched, or irritated for long periods. When you sit heavily on the perineum, the sensory nerves in that region are compressed. Short episodes may just cause mild tingling or numbness that fades quickly, but repeated compression over months and years can change how these nerves behave. Some men begin to notice that sensitivity in the intimate area is not the same. It may feel duller in some spots, overly sensitive in others, or simply off. That change in sensation can interfere with arousal, with the brain's ability to interpret touch as pleasant, and with the subtle feedback loops that help maintain an erection. The third element is strain. Many men have learned, often without realizing it, to treat every bowel movement as a strength exercise. They hold their breath, tighten the belly, clench the buttocks, and push strongly downward. That pressure increases the force inside the abdomen and the pelvis. Once in a while, if the stool is unusually hard, the body can tolerate a bit of extra effort. But when this becomes a daily pattern, something else develops: a chronically tight, overworked pelvic floor. The pelvic floor is a group of muscles and connective tissue that forms a sort of hammock at the bottom of the pelvis. It supports the bladder, the rectum, and the prostate. It contributes to continence, posture, and intimate function. Most men hear about strengthening it, but not enough people talk about the importance of releasing it. A pelvic floor that is constantly tense is like a fist that never fully opens. That chronic tension compresses blood vessels in the area, interferes with nerve function, and can make it harder for the body to switch into the relaxed state required for erections. During a bowel movement, each time you hold your breath and push intensely, those muscles are forced to brace hard. Over time, they forget how to relax completely. There is also the question of posture. On the toilet, many people lean forward, elbows on thighs, shoulders rounded, neck bent over the screen. That position keeps the diaphragm from moving freely, which limits your ability to take deep, calming breaths. A shallow, fast-breathing pattern activates the fight-or-flight side of your nervous system. Erections, however, belong to the rest and digest side. You can imagine how confusing it is for the body when you ask it to relax and perform in the bedroom, but you have trained it day after day to associate the pelvic region with tension, pressure, and a stressed breathing pattern. Another bathroom habit that affects intimate health is ignoring the urge to urinate for long periods. Many men, out of convenience or habit, hold their urine while driving, working, or watching television, even when the bladder is quite full. The pelvic floor and the muscles around the urethra must contract continuously to keep everything in. Over the years, this can lead to overactivity, fatigue, and coordination problems. You may notice a weaker stream, difficulty starting to urinate, or the feeling that not everything is emptying. Some of the same muscles and nerves that manage this are involved in erectile function. When they are always working at the limit, they are less available for subtle, coordinated tasks. Sometimes men also push to force out the last few drops of urine. This repeated pattern of straining can again reinforce tension around the base of the penis and the perineum. It may seem like a small thing, but it's part of the same story. A pelvis that spends more time contracting and fighting than releasing and allowing. Now, it is important to be very clear. This bathroom habit is rarely the only cause of erectile problems. Conditions like high blood pressure, high cholesterol, diabetes, smoking, excess alcohol, obesity, low activity, chronic stress, anxiety, and certain medications play a major role. However, when your arteries and nerves are already carrying these burdens, an additional daily source of compression and strain can be the extra weight that pushes the system further into difficulty. The good news is that unlike some risk factors you cannot fully change, your bathroom routine is something you can adjust starting today. So what can you do, in practical terms, to stop making things worse from the toilet and begin turning that space into an ally for your intimate circulation? The first step is simple but powerful. Keep your phone and reading material out of the bathroom. Decide that the toilet is for using the toilet, not for catching up on news or messages. At first, this may feel uncomfortable, especially if the bathroom has become your quiet refuge. But your perineum pays for that quiet time with every minute of pressure. You can still enjoy a peaceful moment with your phone. Just choose a normal chair or armchair that supports your weight on your sitting bones, not on the delicate tissues of the perineum. The second step is to limit how long you sit on the toilet. A helpful guideline for many people is to aim for finishing in about 5 minutes. If 10 minutes pass and nothing happens, it is usually a sign that your body is not ready, not a signal that you should push harder. In that case, stand up, walk a little, drink some water, and return later when the natural urge comes back. Forcing things when the body is not sending a clear signal only trains more strain and more pressure in the pelvic area. The third step is to adjust your position. Ideally, your feet should be firmly planted on the floor or on a small footstool, so the knees are a bit higher than the hips. This posture straightens the lower part of the colon and makes it easier for stool to exit without extreme force. Your back can be slightly tilted forward, but try not to collapse completely over your thighs. Keeping the chest a little more open allows your diaphragm to move, so you can breathe more deeply, and try to avoid resting all your weight directly on the perineum. Subtle shifts in how you sit, with more of the load on the broader parts of the buttocks, can make a real difference over time. The fourth step is to change the way you breathe and help your body during a bowel movement. Instead of holding your breath and pushing hard, try to cooperate with gravity and gentle pressure. One useful technique is to breathe in normally, and then, as you exhale slowly, imagine you are blowing through a thin straw. As you let the air out, allow the belly to soften rather than tighten. Visualize the pelvic floor letting go downward like a parachute opening, instead of bearing down like a piston. This kind of breathing stimulates the calming side of your nervous system and teaches the muscles in the pelvis to release instead of fight. At the beginning, it may feel unusual, but with practice, it becomes more natural. Of course, what happens outside the bathroom is just as important. If your stool is often hard and dry, you will naturally feel more urge to strain. That is why hydration and fiber matter. Drinking enough water throughout the day, not only at night, keeps your digestive system working more smoothly. Adding fiber from vegetables, fruits, beans, and whole grains gives stool a softer, bulkier texture that moves with less effort. When you improve these basic habits, bathroom trips tend to become shorter and gentler on the pelvic floor and the perineum. If you increase fiber, doing it gradually and listening to your body is wise, so you avoid bloating and give your gut time to adapt. Movement also plays a crucial role. Long periods of sitting on any chair, not only on the toilet, reduce blood flow through the hips and pelvis. The more you break up sitting with short walks, stretches, or light activity, the easier it is for fresh, oxygenated blood to reach the tissues that support erections. Simple habits like taking a 5-minute walk every hour, doing gentle hip circles, or standing up while talking on the phone can create small waves of circulation during the day. Those waves over months and years support not only your heart and brain, but also your intimate health. I want to share with you the story of Mark, a 67-year-old retired teacher. He came to one of my wellness sessions, convinced that his struggles in the bedroom were purely a matter of age. He had noticed a gradual decline in firmness after his early 60s. He was not on many medications, his blood pressure was controlled, and his lab tests were not alarming. When we talked about his daily routine, he mentioned something he considered almost irrelevant. In the morning, I sit in the bathroom with my phone for 20 minutes. That's my peace time. When we looked more closely, that peace time was actually 2 or sometimes 3 long toilet sessions every day, always with the same pattern: phone in hand, leaning forward, straining when things did not move easily. With Mark, we decided to run a simple experiment. For 1 month, he would leave his phone outside the bathroom. He would give his body 5 to 7 minutes on the toilet. If nothing happened, he would get up and try again later. We also added a small footstool under his feet and practiced the soft exhale technique instead of hard pushing. Finally, he started drinking a glass of water on waking and added a portion of fruit and oats to his breakfast. That was all. We did not change his medications or add any supplements during that period. After 4 weeks, Mark came back with a shy smile. He said, "I'm not 20 again, but I feel more life down there. Less numbness, less heaviness after sitting. And when I'm with my wife, I feel like my body responds a little faster." What changed? Part of it was likely an improvement in circulation from shorter, healthier bathroom visits and better hydration. Part of it was probably the reduction in chronic tension in his pelvic floor. And part of it was the emotional shift. He had taken a concrete step to support his own health, which increased his confidence. Another man, Ernest, 72, arrived frustrated, sure that his prostate was the root of all his problems. He had weaker erections, yes, but also rectal discomfort, a constant feeling of fullness in the lower pelvis and occasional leakage. His tests did show some enlargement of the prostate, which is very common for his age, but nothing that fully explained the level of discomfort he described. When we carefully reviewed his habits, we discovered that he often felt his bowel movements were incomplete. That sensation drove him to stay seated for long periods, returning 2 or 3 times in a row, pushing hard each time to finish the job. The more he strained, the more irritated the area became, and the more he felt that something was left behind. For Ernest, the key was to rebuild trust in his body's signals. He agreed to a plan. When he felt the urge, he would go, sit with good posture, use relaxed breathing, and then accept whatever amount the body released without forcing more. Once the urge faded, he would stand up and leave, even if part of his mind insisted there must be more. He also consulted with his healthcare provider to adjust his diet and rule out any serious bowel issues. Over several months, the sense of incomplete evacuation slowly decreased. The rectal discomfort became less intense, his hemorrhoids calmed down, and he noticed that erections, while not perfect, were less painful and more reliable. By protecting the perineum and teaching his pelvic floor to do less fighting, he freed up resources for healing and function. These stories are not miracles. They are examples of how seemingly small daily choices influence the terrain on which your intimate health stands. The more you reduce unnecessary compression, pressure, and stress in the pelvic area, the more space you give your body to use the circulation and nerve capacity it still has. Even if you have medical conditions that cannot be fully reversed, you can stop pushing your system in the wrong direction and start creating conditions that support whatever recovery is possible for you. There is also an emotional side to all of this that I do not want to ignore. Erectile difficulties can feel deeply personal. Many men carry shame or frustration, or they simply shut down and avoid intimacy altogether. When you feel that your body is failing you, it is easy to give up. Adjusting your bathroom habits might seem like a small gesture, but it is also a statement to yourself. I am not powerless. I can make changes that support my health. That sense of agency matters. It reduces anxiety, which in itself can ease some of the tension that blocks good erections. If you are in a relationship, sharing what you are doing can also improve connection. You might say, "I'm learning more about circulation and pelvic health, and I'm changing the way I use the bathroom because I want to take better care of my intimate health." That is not a confession of weakness. It is a sign of commitment and care. It tells your partner that you value your shared intimacy enough to work on it. Often, that opens up space for honest, supportive conversations instead of silence and guesswork. Now you may be wondering how long it takes to notice any change. The answer depends on many factors: how long the habit has been in place, what other health conditions you have, and how consistent you are with new behaviors. Some men notice subtle differences in a few weeks: less numbness, less heaviness in the pelvis, a more responsive feeling when aroused. Others need months to feel clear improvements. The point is not to chase an overnight transformation, but to understand that bathroom habits are one piece of a larger puzzle that includes movement, nutrition, sleep, emotional health, and medical care when needed. There are also times when you absolutely should speak with a healthcare professional. If you notice blood in your stool, unexplained weight loss, severe pain, sudden changes in bowel or bladder habits, or erectile difficulties that started very abruptly, those are signals that deserve proper evaluation. Changing your bathroom routine is supportive, but it does not replace appropriate medical assessment. The goal is to combine both: professional guidance for serious issues and intelligent self-care for daily habits. When I look at everything we have covered, I can summarize the core idea in one simple sentence. Your bathroom can quietly drain your intimate vitality if you treat the toilet like a reading chair, but it can support your circulation and confidence if you use it briefly, gently, and with respect for your body's signals. That's the heart of this message. The same place where you might unknowingly be adding pressure and tension can become the place where you practice release, patience, and care. And here is the most important piece of hope I want to leave with you. It is never too late to change this. Even if you have been taking your phone to the bathroom for 30 years, even if you already have some erectile difficulties, your body still responds to better treatment. Nerves can calm down, muscles can learn to relax, blood vessels can work more efficiently when they are not being compressed. You may not return to how things were at 30, but you can absolutely move toward more comfort, better circulation, and greater confidence. If today's conversation made you recognize some of your own habits, I invite you to do something very simple over the next few days. Just observe. Notice how often you bring your phone into the bathroom. Notice how long you stay seated once you are done. Notice whether you hold your breath and push or whether you allow your body to work with gentle support, not to judge yourself, but to gather information. From there, choose one small change and practice it consistently. That might be leaving your phone on the table outside, or standing up after 5 minutes no matter what, or using the relaxed exhale technique instead of straining. You do not have to tackle everything at once. Every time you shorten a bathroom visit, you are giving your perineum a break. Every time you choose relaxation instead of force, you are teaching your pelvic floor a new pattern. Every glass of water and every extra serving of fiber helps make the whole process easier, which means less stress for the very tissues you rely on in the bedroom. These are small bricks, but together they build a different future for your intimate health. My friend, thank you for sharing this time with me. I am Dr. Mary Parker, a wellness educator in men's health and longevity. If you want to keep learning about natural habits to support your circulation, energy, and confidence in the second half of life, I invite you to reflect on what you heard today, to share this message with another man who might need it, and to stay connected so we can continue this journey together. Your age does not erase your value, and it does not erase your right to feel alive, connected, and respected in your own body. Sometimes the path back to vitality starts in the most unexpected place, with a simple choice, right there, in the bathroom.